Picture this. You're sitting in your favorite chair, maybe watching TV or reading the paper, when a strange pressure creeps across your chest. It's uncomfortable, but not unbearable. So you tell yourself, it's probably just something I ate, or I'll wait a minute and see if it goes away. Sounds familiar, right? So many people over 60 do the same thing, brushing off what might actually be their body's urgent cry for help. The truth is, those first few minutes after a heart attack are the most critical. What you do in that tiny window can mean the difference between life and death, between a full recovery and lasting damage. Now, I know this isn't an easy topic to think about. Nobody likes to picture themselves or someone they love in that kind of emergency. But being prepared isn't about being scared. It's about being smart. It's about taking calm, confident control when every second counts. So today, let's sit down together and talk clearly and honestly about what to do in those first 5 minutes of a heart attack, especially after 60, when our hearts deserve a little extra care. Let's start with the single most important step, calling emergency services right away. I can't emphasize this enough. Do not wait to see if the pain or pressure passes. Don't think, I'll just lie down for a bit, or maybe it's just gas. In those critical minutes, hesitation is dangerous. Time really is muscle. Every minute without proper treatment means more of your heart muscle is losing oxygen. Once it's damaged, it can't grow back. Imagine this scenario. You're at home watching TV, and suddenly there's a tightness across your chest. It might feel like someone's sitting on you, or you notice shortness of breath, a cold sweat, maybe nausea or dizziness. The instinct for many people, especially older adults, is to downplay it or not bother anyone. But your safest move is simple. Stop what you're doing, sit upright, grab your phone, and call your local emergency number immediately. Put the phone on speaker so you can keep your hands free and follow the dispatcher's instructions. Don't drive yourself, and don't let someone else drive you unless absolutely no other option exists. Why? Because ambulances aren't just transportation, they're mobile emergency rooms. Paramedics can check your heart rhythm, give oxygen, perform CPR if needed, and even send an ECG to the hospital before you arrive. That means the cardiac team can be ready and waiting for you the moment you come through the door. Those precious minutes can save your life. If you're a caregiver or you live with a spouse or parent who's over 60, make sure everyone in the home knows what to do. When symptoms start, chest pain, shortness of breath, sudden fatigue, don't second guess. Call first. Always call first. Even if it turns out to be something less serious, no one will ever fault you for being cautious. But waiting can cost you everything. Now, once that call is made, the next few minutes are all about listening. The dispatcher's guidance matters more than you might realize. These professionals are trained to recognize cardiac emergencies within seconds of hearing your voice. They'll ask questions about symptoms. Is the person awake, breathing normally, sweating? And then they'll walk you through exactly what to do step by step. If the person becomes unresponsive or stops breathing normally, the dispatcher will guide you through CPR right there over the phone. Even if you've never done it before, they'll tell you exactly how, where to place your hands, how hard to press, how fast to go. You don't need to be perfect, you just need to start. Those compressions keep blood flowing to the brain and heart until professional help arrives. Studies have shown that dispatcher-assisted CPR can double survival odds in cardiac arrest. But not every heart attack leads straight to cardiac arrest. If the person is awake but showing clear signs, chest pressure, nausea, dizziness, cold sweat, the dispatcher may instruct you to help them sit upright, stay calm, and avoid any exertion. They might even ask about medications, such as whether the person has a prescription for nitroglycerin, or if they've recently taken any medication for erectile dysfunction, which can affect how nitroglycerin should be used safely. One key tip that often gets overlooked is keep the phone line open. Don't hang up even if you think help is already on the way. The dispatcher can update instructions immediately if the situation changes. For example, if the person faints or their breathing slows. They may also suggest sending someone outside to meet the ambulance, turning on porch lights, or unlocking the front door to save time. In emergencies, every second shaved off the response time matters. And here's a practical piece of advice that can make all the difference before you ever need it. Also, keep a simple medical information list near the phone: your address, medications, allergies, emergency contacts. When fear takes over, it's easy to forget details, and having that information ready can save precious moments. Now, let's be honest, it's easy to panic in those moments. Your heart is pounding, you're scared, maybe confused. But remember, the dispatcher's voice is your lifeline. They're calm, experienced, and they know exactly how to help you keep your head clear and your hands doing what needs to be done. You're not alone in those minutes. So, in those first crucial steps, call emergency services immediately, follow the dispatcher's instructions closely, and let them guide you through whatever happens next. It's not about being brave or stoic, it's about being smart and giving yourself or your loved one the best possible chance of survival. Now that that call is made and help is on the way, the next few moments are about making sure emergency responders can reach you quickly and safely. You'd be surprised how much time can be lost simply because paramedics can't get through a locked door or they're searching for the right apartment at night. So as soon as you can, and only if you're not feeling faint or short of breath, unlock your main door and turn on the lights near your entrance. It might sound like a small detail, but it's one of those small things that can make a big difference. When every second matters, a locked door can delay care by precious minutes. If you live in an apartment building or a gated community, it can take even longer. Paramedics sometimes have to break through doors to reach a patient, and that lost time can mean the difference between a treatable heart event and a life-threatening one. If you're alone, unlock the door, then return to your seat and stay calm. Keep your phone on speaker so you can continue to talk to the dispatcher. If someone is with you, a spouse, friend, or neighbor, ask them to stay near you while another person meets the paramedics outside. They can turn on porch lights, hold the elevator, or wave down the ambulance from the street. These small, thoughtful steps shave off valuable seconds and help emergency workers find you faster. And if you have pets, it's a good idea to make sure they're secured in another room before the responders arrive. Not only does it keep them safe and calm, but it also prevents any unexpected chaos at the door. Paramedics move quickly. They'll need space to bring in equipment, stretchers, and monitors. A clear, well-lit path to where you're sitting helps them start care immediately. Once you've handled that, the door's unlocked, lights are on, path is clear, your next focus should be making sure responders have quick access to your vital information. When paramedics arrive, they need to know your medical history, medications, allergies, and any special instructions as fast as possible. This isn't just paperwork. It can shape how they treat you in those first critical minutes. Imagine trying to remember all your medications or past procedures while you're in pain or short of breath. It's almost impossible. That's why it helps to keep a simple, one-page medical information sheet ready. It should include your name and date of birth, emergency contacts, major medical conditions like heart disease, diabetes, or kidney issues, any allergies, especially to medications, and a list of everything you take with doses if possible. If you're on blood thinners like warfarin, apixaban, or clopidogrel, or if you take both aspirin and another platelet medication, that's crucial information for the emergency team to know. It tells them whether it's safe to give certain drugs or if they need to take extra precautions. The same goes for anyone with a pacemaker, stent, or defibrillator implant. Those details can change what kind of monitoring or treatment you receive right away. If you're comfortable with technology, you can also set up a medical ID on your smartphone. It shows critical health info right on your lock screen.
No password needed. That means if you're unconscious or can't speak, paramedics can see your health conditions, medications, and emergency contacts instantly. And here's a thoughtful step that often gets overlooked. Include your preferred hospital on the list, especially if it's one equipped for heart procedures like angioplasty or stent placement. When paramedics see that, they can alert the hospital ahead of time. In some cases, the cardiac team can be ready to treat you the moment you arrive, cutting down what doctors call door-to-balloon time, and that can make all the difference. When you think about it, Surviving a heart attack isn't just about what happens in the hospital. It's about what happens before you even get there. Making sure your home is accessible, your lights are on, and your information is ready gives you a head start when minutes matter most. And while you're waiting for help, there's one more crucial piece to remember: keeping calm and avoiding anything that might strain your heart further. So now you've called for help, the door is open, and your medical information is ready. The hardest part can be what comes next: waiting. Those minutes before help arrives can feel endless, but what you do or don't do in that time really matters. Your main goal is to keep your heart as calm and steady as possible until professionals take over. Stop everything. Sit upright, preferably in a chair with back support, not flat on the floor or lying down. Sitting upright helps your lungs expand and your heart work more efficiently. If you feel dizzy, it's okay to lean slightly forward with your arms resting on a table or pillow. Try to keep your body still and your mind focused on slow, steady breathing. In through your nose, out through your mouth. And here's something many people don't realize too: temperature matters. Extreme heat or cold can add stress to your cardiovascular system. Both heat and cold can cause sudden shifts in blood pressure, which is exactly what you want to avoid right now. Avoid eating or drinking anything, even if you feel thirsty or a bit faint. Heavy meals or even snacks can divert blood to your stomach and away from your heart, and that's not what your body needs in these moments. If you've taken any medication for erectile dysfunction in the past day or two, drugs like Viagra, Cialis, or Levitra, do not take nitroglycerin. Combining them can cause a dangerous drop in blood pressure. It's okay to mention this to the dispatcher or paramedics when they arrive. They're professionals, and the more they know, the safer your care will be. If you're with someone having a heart attack, your role is to keep the atmosphere calm and focused. Reassure them that help is coming. Remind them to breathe slowly and avoid moving. Sometimes just holding their hand or speaking gently can help lower anxiety and steady their heart rate. And if the person suddenly loses consciousness or stops breathing normally, you'll be coached step by step through CPR. Even if you've never done it before, your hands can be the reason their heart keeps beating long enough for help to arrive. Now, let's talk about planning ahead, because preparation before an emergency can turn panic into calm action. In those few minutes before help arrives, it's okay to feel scared. That's normal. But remind yourself you've already done the most important things. You've called for help, you've unlocked the door, you're sitting safely, and you're giving your heart the best chance to make it through. Panic only makes your heart beat faster, so focus instead on what's within your control: your breathing, your posture, and your calm. Each breath you take is a step towards safety. And when help arrives, trust them completely. Paramedics are highly trained professionals who know exactly what to do in these moments. They'll check your vital signs, monitor your heart, give oxygen, and may start treatments right there in your living room before transporting you to the hospital. You're in good hands. Now, let's take a step back for a moment. Everything we've talked about, calling for help, following dispatcher instructions, unlocking your door, keeping your information ready, keeping calm, and avoiding triggers, these are all simple actions. And here's something truly worth remembering. Surviving a heart attack doesn't just depend on what doctors do in the hospital. It depends on what you do in the first 5 minutes. Those minutes belong to you. And your quick, calm actions can protect your heart more than you might imagine. If you take one thing away from this conversation, let it be this: never ignore your body's warning signs. Don't wait, don't second guess, and don't worry about bothering anyone. Your life, your heart, your future, they're worth that phone call, that preparation, that calm response. And if you're watching this thinking, I wouldn't even know where to start today. Write down your medications. Check your phone's emergency settings. Make sure your house number is visible. These aren't just chores, they're gifts you're giving yourself and the people who love you. Because life after 60 isn't about slowing down. It's about living smart, living aware, and being ready for whatever comes. You've made it this far because you've learned how to adapt and take care of yourself, and this is just one more way to do that. So here's to you, to strength, to awareness, and to knowing that you have the power to protect your heart when it matters most. Remember, small steps can save big lives, and that life might just be your own. If this video helped you, share it with someone you care about. You never know, it could save their life one day. And don't forget to like this video and subscribe for more practical health tips designed just for you. Take care of your heart, take care of yourself, and remember, every heartbeat is a gift. Cherish it.